What's up, YouTube? It's another driving video. A video where I talk about things while I'm driving. So today on the radio, I heard about the opioid epidemic here in the United States and how it's disproportionately affecting men, and suicide and depression also disproportionately affecting men. I heard a lot of talk about the symptoms of what the problem is here. You know, they were talking about depression. They were talking about how addiction is such a horrible thing, and I agree, but I didn't hear any real talk about why men are disproportionately affected so much more than women. And I know why they are, and I know a lot of people won't accept the reasons why. So it starts off extremely early in childhood, of course. Most men in this country are strapped down and traumatized, sexually traumatized in a genital mutilation surgery, as they call it. So most men live their entire life with sexual trauma. Then men are not allowed to talk about their trauma, and if they try to, they will be seen as weak. They will be seen as complainers. They will be told that nobody else is complaining. They'll be told all these gaslighting and invalidating things if they try to talk about it. So most men just shovel it off to somewhere else and don't think about it. And this means that all that anger that comes with being violated, with being completely out of control of yourself, reduced, traumatized, and all that depression, all the anxiety, any negative feelings they're having about it are never connected with that trauma. So they're allowed to just fester. You know, that trauma is just never processed. And also, this genital cutting makes men's bodies feel wrong. It makes them feel off. It makes them feel uncomfortable. Their penis will rub against things. Some people have pain. Some people have discomfort. Really, everybody in some level that is circumcised does not feel right. So why this intersects with opioid use is because opiates are probably the only thing that will allow a man who is cut to ignore this feeling that they have, this feeling of their body being wrong, this negative feeling coming from their body. It is the only way a lot of men can feel good about that and forget it for a while. And of course, this depression and this trauma, this anger that they carry, it contributes to negative stereotypes about men. You know, these men carry this anger. All of them do that are circumcised. Don't believe that they don't. And they never process it. So this anger gets directed all sorts of places where it doesn't belong, right? This mutilation causes men to be more emotionally withdrawn and more angry and more violent. It drives this negative perception of men that men are violent, which isn't true. And so it contributes to male violence, basically, but it also contributes to male depression. So these people aren't feeling good mentally either. And of course, I said they aren't allowed to process their trauma. They aren't led to their trauma. They don't figure it out on their own a lot of the time. So to mitigate these negative feelings, they will trend towards drugs. And not just opiates, but a lot of drugs. You know, if someone trends towards opiates, they're probably in some sort of pain. You know, if somebody trended towards psychedelics, they might be unhappy with some way they think, or some aspect of the world that bothers them often that's more spiritual or conceptual, right? If someone trends towards weed, maybe that's a PTSD thing or something like that, you know, since weed is good for that. If they trend towards alcohol, that's, you know, they're trying to numb themselves in a similar way with opiates. They don't feel good. They want to block out all these negative feelings they have. So basically what I'm saying is We really, really, really need to stop attacking symptoms of problems. If a drug addict that's male goes into therapy, goes into rehab, and the reasons that they were on drugs are not addressed, then they're probably going to go back to drugs. You know, if men are not aware that a lot of their problems, their sexual problems, their body image problems, their depression are in large part due to this violation of their autonomy and their body, then they will likely pass it on to the next generation and make that generation sick. They will likely pass it on to their sexual partners and romantic partners. They will not function properly. And a circumcised man will never function sexually properly. They'll never function mentally like they would had they not been circumcised. It's a big, big problem for a circumcised man, even if they are processing it, because they will become aware that they will never, ever mentally or physically be the person they should have been. This is heavy on people, all right? And they need to know. It's not causing problems to let them know. It's solving problems. It's solving future problems and current problems. So again, just everything I've been hearing about male depression, male suicide, male drug addiction is really avoiding the issues. Almost every man in the United States, if you had 10 men, at least 8 of them, statistically, would have sexualized trauma that we know of. You know, that's outside of other trauma men accrue, and they aren't allowed to talk about it. So this is definitely causing the rate of depression to be higher. It's causing a lot of issues. I don't want to attribute everything to circumcision, you know, but this is so easily contributable to circumcision. It's taking a person in the most malleable part of their life, mentally, and just violating every boundary they have. It's giving them trauma in their most formative part of their life. It is welcoming them into the world with battery, with violence. It's definitely affecting them. We can see it. We can see it in our population. We can see it in our sick men. We can see it in our withdrawn men. We can see it in our violent men. I don't know why people would deny this. And again, I say I don't want to attribute everything to circumcision, but it is such a massive issue that men face that if we're talking about an issue of men, whether it be men being violent, men being withdrawn, men being poor, men being dysfunctional, men being prone to suicide, we have to consider this. Trauma is the biggest indicator of depression, anxiety, and drug addiction, all these things. So when I see people talking about the opioid pandemic, and they don't talk about this, when I see people talk about male suicide and male depression and they don't talk about this, all I feel is that they have failed me. They have failed all these men when they don't publicize why more men are having these issues. And then a lot of the time they turn around and act like men have it better than other people, which I don't understand that either. Men have it much worse in this country. You cannot find a random group of 10 women where 8 of them at least have been mutilated and raped. You cannot. You cannot show me statistics on suicide that show more women committing suicide than men. You cannot show me statistics on mental health that show women are doing worse than men. All right? So just not to gaslight women's issues. Women's issues are real issues. But stop gaslighting male issues. Stop blaming these men that have been raped, that have been mutilated, that have problems because of it. Stop denying the reality of the situation. Stop proposing fake solutions. Stop bullying men into silence about their trauma. Stop leading them away from their trauma. Stop giving them crap solutions. Stop feeding me lies. Stop avoiding the issues.